Hey, chiropractors, welcome to Modern Chiropractic Mastery with your host, Dr. Kevin Christie, where we discuss the latest in marketing, business, and professional growth with some of the leading experts in the industry. Docs, welcome to episode 3 of 4 of the special MPI MCM podcast series, where we discuss being world-class at treating athletes. And in this interview, I have Dr. Steve King. And this is actually a past interview we did on being a pro sports team chiropractor. Steve is the team chiropractor of the Cincinnati Bengals, which, if you're listening on this day that it came out, it's a Monday morning, and hopefully the Bengals beat the Buffalo Bills. I'm just a recovering Dolphins fan, so don't hate me out there, Bills fans. But Steve, he's been with the Bengals for quite some time, and we interviewed him a year or two ago about that, and it just was fitting to have that part of this 4-part series because some of you may be lucky enough at some point to work with a pro team, right? It doesn't have to be NFL, it could be any pro team. And frankly, you're going to get a lot of insights from this interview that would help you be a college team chiropractor or a high school team chiropractor or even a youth team chiropractor. So a lot of great insights that we dive into on what it's like, really integrating with a first class type of medical team that obviously like a NFL team would have, and just a lot of cool insights from Steve on what it's like to integrate into that, and it could be different, right? Like he does a lot of things in his private practice that he doesn't do when he's with the Cincinnati Bengals. He is very targeted in what they brought him on to do and serves a great purpose there for the Bengals. And he shares a lot of his insights on that. And as you know, before we get into the interview, we have a great MPI Sports Summit coming up in March 25th, 26th. And this is going to be in Overland Park, Kansas at Cleveland University there. I'll be there Friday speaking to the little TED Talks, but also I'll be there the weekend attending some of the classes. And this has got quite a lineup. It's got Mark King, Corey Campbell, Brett Winchester. It's going to have Jason Holm, David Seaman, Rich Holm. And it's going to be all about the lumbar spine. And it's everything from manipulation to DNS, to soft tissue work, to nutrition, to assessments, right? Like basically all the stuff. Our first episode in this 4-part series was with Dr. Mark King, where we talked about the multimodal approach. And essentially that's what this seminar is. And it's just really good. I was at the last live one they had, which was right before the pandemic. And it's been, unfortunately, canceled each year because of the pandemic. And it was being in the Chicago area. Now it will be in Overland Park, Kansas. So check that out. Go to motionpalpation.org. Check out their seminars tab, and you can register right online there. I hope to see you there. And without further ado, here is my interview with Dr. Steve King. All right. Welcome to the virtual summit on sports chiropractic. I'm excited to have you, Dr. King, and we're going to dive into everything football. So you've been working with the Cincinnati Bengals for quite a while, and it's been, I know, quite an experience for you, tons of Super Bowls and playoffs. So tell us a little bit about yourself and practice and all that. I've always been a fan of what you've been doing. And I just like how you apply the clinical to the team. And we're going to dive in today to the clinical side and the team side of stuff. And before we do that, just tell us a little bit about yourself.
So I've been unofficially with the Bengals for, gosh, at least 15 years. And officially, I'm going on my 4th year.
Nice.
And the last 2 years have definitely been a struggle.
Well, I'm a Dolphins fan, so I feel your pain.
Yeah. So it's been fun though. I've worked with players here at the office, but the last couple of years I've actually gone to the stadium and worked in the medical training facility.
So how did you get that opportunity? What transpired for this all to happen?
So I developed a relationship with Paul Sparling, the head athletic trainer for the Bengals. And it was kind of interesting. And one of the messages I'm hoping to get across is, I treated him just like almost like a medical doctor. I wanted to communicate to him just like I would with a medical doctor, what I was doing with the player. And that started here at the office. And through communication and developing that relationship, it grew, and he sent more players.
Yeah, and this is one of the things where I've noticed it's great because obviously we'd all love to be a team chiropractor for an NFL team. There's only 32 of those, so that's a problem. And
Right.
then if you happen to be in a city that doesn't have an NFL team, obviously you're not going to be an NFL team chiropractor. But this can relate to colleges, high school, even youth. And you could probably apply this. You could definitely apply this to other sports as well: baseball, football, or sorry, baseball, basketball, hockey.
Right.
But for the sake of our conversation today, we're going to be talking about football. So I think your entry into it as an athletic trainer and working with that person was great. And you had a player come to your office. I think as chiropractors, we can all think of players that are in a high school team or a college team that have come to our office and you did well by them. That could be your entry into this whole thing because you've
Right.
communicated to that athletic trainer, like, hey, I got one of your players. Obviously, you want to probably have that conversation with the player first. So you don't violate any HIPAA or anything like that. But starting that conversation, that could get you some credibility with that particular program. And that's what happened with you, right?
Yes.
Perfect. Good. So I want to, again, team chiropractor. This looks differently, I think, in a lot of ways, but the key to it is communication. What before we dive into that, what is your specific role with the team? Because I know some chiropractors will do certain things and other. What is your defined role?
So my defined role is to provide adjustments and to provide manipulation.
Mhm.
And so it's really been kind of fun. I mean, I what I've trained for and worked so hard to get good at,
Mhm.
I get to do. And so it's been a blast. I'll go to the training room. I set up my just like my office. I have a motion palpation chair and my Gonstead bench and my Gonstead chair, and I the player sits down. I do my motion palpation scan, and I go to work and adjust, and don't have to worry about therapies or modalities or any of that stuff. I don't have to do ART or Graston, and it's great.
Yeah. And that's why I think is a key thing for our audience to understand is that even though you may do a lot of things in your office, you may be hired or brought on to do one specific thing, and
Right.
that's a lot of times the situation. And um, I'm assuming you've
Right.
done a job because you've been there for longer than 1 year. That you've done a good job of staying in your lane and providing a very good service that was well defined, and but you probably notice certain things like, oh, maybe they need this. Do you communicate that with the athletic trainer? Is that the person you would say, "Hey, look, I also kinda saw this, maybe they could use something," or how does that work?
Yes. So depending on the situation, I'll get asked to do an evaluation uh, to figure out a low back situation or a neck situation, and then I'll go through my thing. Usually do a treatment, and then kind of talk back. And sometimes I'll say, "Well, I think they need an X-ray, or I think they need that hip X-rayed, or something like that." So that works out great. I almost always do some kind of a treatment that involves a manipulation or adjustment, and that it works out good.
Yeah, perfect, and I would assume in your situation, the athletic trainer is kinda the gatekeeper, right?
Yes, he really is. And
Mhm.
Monday morning is the big assessment day where the head doctor, the head orthopedist, and the head athletic trainer get together and they go through the injury reports, do the evaluations, and then I actually come in on Tuesday, and Tuesdays and Fridays.
Perfect, and so, yeah, I think that's something to make sure let's say let's fast forward and I'm speaking to the audience right now, and you get this opportunity to work with a football team, and you have your role defined as manipulation only. It could be more. It could be ART. Like I know there's some team Kairos, the Dolphins in particular. They have him doing some active release. So you define the role. You get very clear on that. You stay in that lane. But then I think it's also to do diligence and figure out, okay, what's this process look like? And most likely high school, college, and NFL is going to be athletic trainer as the gatekeeper. but then you need to know who are the other players, like, or not players. I don't want to get confusing, but the other medical players that are in that.
Right.
Is it the ortho? There's a neuro, maybe there's a concussion special. Like there's these teams are pretty well developed. Um, how did you figure out what was in place, the team from the medical and even over to the strength and conditioning? How was that process for you?
Well, it was so simple, and to be honest with you, the the, uh, the players initially when I started, again, I had the same role when I wasn't officially a team chiropractor. Players would come, they would have non-specific low back pain. They would, "Oh, my neck stiff," or "My low back stiff," or "My hip stiff." And then I would go through my exam and be real careful, of course, but I do my manipulation and so the role developed as I continued to see more players. And it was really, it was just really, it's actually kind of nice because it, again, I don't have to tape. I don't have to do ART and I don't have to do rehab exercises. And so it was really kind of just laid out for me. It was really it's been kind of easy.
Yeah. And then is there a particular communications system that you guys use for the team? Like, do they brief you on Tuesday when you come in? How does that work?
Yeah, and it's usually a lot of times and it isn't always just the head athletic trainer. There's actually a physical therapist,
Yeah.
the head physical therapist, rehab guy,
Mhm.
or other assistants. And depending on who's working with who, they'll give me but it's all communication, just
Mhm.
verbal.
Yeah.
And I just keep track of who I work on, and of course they keep track. I don't even know what their system is, but they have. It's all about injury reports,
Mhm.
and who are they going to be ready for Sunday or not?
That's for sure. And then I was, I'm assuming you have to be a little humble in this type of scenario and just say, you know, I know I could do that, but I'm not going to, or I'm not going to step on any toes. Does that happen a
Yeah,
lot?
yeah, absolutely. Yeah, and I start, exactly. I want to start doing, DNS or some kind of rehab thing, or teach somebody how to squat or breathe, or so I have to, I have to try and stay in my lane. But I can do things and affect their function without acting like I know how to squat better than, a professional offensive lineman.
And I'm sure over over some time, once you build that rapport and credibility with the team, you can make some more suggestions than you did probably year
Yeah.
one.
Right, exactly. It's pretty laid back, but yeah, if I feel something's strong enough or important enough, I definitely will say my part. Whether gets changed or not, that's different. But
Yeah, that makes sense. And I know it's like, because you might see the physical therapist doing something, and you're like, oh, I probably wouldn't do it that way. But this is a skilled person that's been doing a lot of stuff. There's different ways of doing it, and you have to know when to just kind of be humble with that. I have a funny story. I used to practice down in Davie, Florida, which is where the Dolphins headquarters is. So it's not actually Miami; it's more Fort Lauderdale. And we used to treat a lot of the Dolphins players. And I remember my a chiropractor that I worked with at the time, he had emailed the strength and conditioning coach all these exercises he felt like this player should be doing and shouldn't be doing. And the email was benign, but you know how email can be. And I remember the email back from the strength and conditioning coach is like, I've been doing this for 20 years. I've been with the Dolphins for X amount of years. I know what exercises my players should be doing and not doing based on my communication with the athletic training department. I mean, it was just like, and I read through the email,
yeah,
just like, yeah, you probably shouldn't have sent that email. I mean, you kind of put him in his place as being, like more than him type of thing. So you got to be
yeah,
careful of that stuff.
yeah, it doesn't work. Yeah, yeah.
Yeah, you got to be.
But it's kind of, as you're there, technically I'm only supposed to adjust players, but staff will come in, coaches will come in, strength and conditioning coaches will come in, and that I develop the respect just by staying within what my role, and then I can kind of slowly, gain, like I said, gain the respect and educate on the chiropractic concepts.
Yeah, that wisdom that you just provided, really relates to again high school, college, NFL, other sports. When you're in that team setting as a chiropractor, you
Yeah.
can't assume that you're going to be the end all be all. You really might have to just provide a job, and that's fine, and and it's rewarding.
Yeah,
That's
it's rewarding and it makes it makes it relaxed. Like I feel confident that I am a good adjuster and I can affect joint function
Mhm.
and I don't have to really go beyond that. It's kind of nice and to say, okay, I'm gonna be the adjuster and it really is kind of fun.
In a minute. We're going to segue into actual like some common football related injuries and such. But would you say on your Tuesdays and Fridays, are you only working with players that are banged up or have issues, or are you also doing some kind of performance care or preventative stuff?
Well, yeah, that's a great way to put it. It's a little bit of both. Many times I see starting players that are hurt,
Yep.
and so and then but then I also have guys that come in routinely. They want to get adjusted every week, and they usually want to get adjusted on Fridays
Hmm.
as opposed to Tuesdays. Is that I know, just they're banged up from Sunday and they're just tired,
Yeah.
and they still want to rest. So yeah, so both.
And
And and
I found that they like to lay on a massage table on Monday, Tuesday because they're so banged up, and
yeah,
then they're ready for the adjustment. Have you also found that a lot of the players don't want to be seen in the athletic training room with the athletic trainer or the people that help with injured people, but they may be more prone to see you for something because it doesn't equate to being injured? Because some of there's that psychology of it.
yeah, absolutely. That's a great question. Yeah, that happens all the time, and I have to be really careful when sometimes they'll kind of sneak in there, and it's wait a minute, did you tell anybody about this injury or what? What's going on here? So I have to be a little bit of a watchdog. So
Yeah, and it's an interesting concept because I've experienced that in the past where a lot of players, especially the ones that are, if you're a Pro Bowler getting multi-million dollar contract, not as much of a concern. But a lot of those players, I mean, it's like dicey between being a starter and being a backup, or being a starter and not even being on the team anymore. And one of the ways to find yourself out of the team is when you're athletic training and injured all the time. Right?
yeah,
Even though it's a misconception a lot of ways, it's in their psyche. And so I feel like they'll tend to go to the chiropractor and get that done because going to the chiropractor doesn't always equate with being injured and not being able to play.
yeah, and there's definitely players that don't even want to step foot in the training room.
Exactly.
They literally don't want to be seen in there, period. And that's kind of interesting. And I think that those guys tend to seek treatment outside of the facility,
Mhm.
outside of the stadium.
And that's when they come to you, right?
Well, I wish, yeah,
Yeah.
some do, but yeah,
I mean, it is a good point because again, I was on the other end of I've never been a team chiropractor, but I
yeah,
saw a ton of NFL guys during season in Davie. My NFL work here in Boca Raton has all been off season. So these are guys that are training in the sports facility here, but are not in the middle of the season. So it's just like not a stressful thing. Like trying to be ready for Sunday is stressful. If it's May, it's not a, but what I found was some people would come and see me and they had nothing against the chiropractor that was with the Dolphins. Chiropractor was great. They just didn't want to be seen at the office getting or at the facility getting treated.
yeah, yeah.
And it's just like,
Yeah, it's gotta keep it quiet. Yeah, it's interesting.
yeah. So, okay. Yeah. I mean, I guess if you're a chiropractor in a town that's got a football team, maybe you'll get some of those. And it's good to, it's a whole other topic and a whole other animal because you can't really communicate that information to the team if the player doesn't allow it in a lot of ways. But
Yeah, and again, I wanted to stress that point again from the beginning and back circling back to it. We want you got to have a system in place on how you
mm,
manage your patients at your office,
yep.
and you want to communicate with the provider, whether it's the medical doctor or the athletic trainer, uh, you know, physician's assistant. We get a lot of referrals from PAs, and communicating with them really it opens up your practice, and they'll ever know what could come out of that.
Oh, yeah, for sure.
So,
Absolutely. And, being a chiropractor is a business and you don't have to divulge how it works with you, but in general, how are chiropractors compensated? Is it through the league, the team? Is it, how does that work?
yeah, and so it varies, and
Mhm.
Some some players are hourly, or and some are fee for service, and some are paid like yearly.
Yeah.
So, and I don't mind divulging. I'm hourly,
Yep.
and so it'll vary from week to week. Sometimes I'll work a couple hours, and sometimes I'll work more. So
Yeah. Perfect. Yeah, I think at the NFL level at that point, when you get that opportunity, it's a paid position, which is great. I've in the past, and I've talked to a lot of chiropractors that have done well with volunteering for the high school, even the college. If you're able to get some promotional stuff out of it, like you're
right.
the official team chiropractor of Florida State University or whatever, and you could put that on your website and do that type of stuff. How is that with working with the Bengals? Are you allowed to promote some of that, or you have to keep it kind of quiet?
I have to keep it quiet, and I can self promote within the office.
Mhm.
But yeah, I can't put a billboard up that says Steve K, Team Chiropractor.
Yeah,
And yeah,
and that's something that you really wanna make sure you get clear on with the team because, you go and put that stuff all over your website and they didn't give you clearance for that, find yourself on the other side of the athletic training room at that point.
right, right. Yeah,
So
so yeah, absolutely.
so whether it's high school, college, or NFL, make sure you get those types of clearances of what you can and cannot do, and then I would recommend, and I'm sure you do the same thing, is don't do the pictures with players in the facility, right? Like, is that kinda like they go over that type of stuff with you?
They don't really go over it with, yeah, but I've known better than to do any of that. I don't even really put pictures of players in the office.
Yeah.
So, but but you technically could if a
Mhm.
player came to your office on his
Right.
own.
Yeah,
So,
that's fine if you do that, but you don't wanna be taking advantage of the situation on the team facility because you probably
right,
don't I would assume don't have the rights to do that.
correct.
So,
Yeah, I don't take pictures in the training room.
yeah.
Right.
Yeah. And I just think there's a lot of those little nuances that you gotta get clear on, and that's why I wanted to have you on this and talk about it because you've been doing it for a while, and a lot of this stuff we don't think about. We just think like, oh, I could slap the Bengals logo on my website. Why not?
Right. Right.
And
You can't do
there's companies spending zillions of dollars to put that on there.
Exactly. Yeah.
It's like, can I put my chiropractic name on the stadium?
She's it'll cost you.
Yeah, it'll
So,
cost a few bucks, but all right, let's segue into the injury side of things, the clinical side of stuff. What are some of the common sports injuries you see? I want to talk about with your work with the Bengals, and what you do. Like, what are some of the things you see in the office?
and that's been fun in some ways, because a lot of times I'll see, because I'm very close to the head athletic trainer, I'll see the starters, a lot of starters, and they'll have something, going on that needs to be addressed.
Mhm.
So, but most commonly is low back pain,
Yep.
and then second is neck pain.
Mhm.
And those are definitely, definitely our specialties. And so those are the two biggies. And then occasionally you'll get some interesting things like a stinger, like a neck pain with a little bit of, the nerve thing going down the arm. And I'll just use my, the motion palpation concepts, and address the joint dysfunctions. And then and then I'll be able to tie in the hips and the feet for the low back stuff, and then the shoulders for the neck stuff, and I kind of just tie it right in without making too big of a deal out of it.
So I want to break down a couple of those with the stinger. What have you found from a palpation standpoint in areas that you've been able to use manipulation effectively?
Yeah, and typically it's this, the same story. You're looking at the transitional segments of the CT junction, and
Mhm.
that's pretty much what I find. And
Yeah.
not I'll find a lot of upper cervical stuff, or so yeah, the neck pains and the rib pains. I still look at that CT area.
Yeah, yeah. I bet you get a
So
lot of that. I bet you the CT
yeah,
junction has got to be one of the top.
oh, it's yeah, absolutely, yeah. And then a lot of SC joint
Yep.
dysfunction. The
That's what I was
shoulder.
going to ask because a lot of times with that stinger, it's kind of like that separation type of deal. And obviously they get that stretch on the nerve, but I'm sure they get a ton of issues with the SC and even maybe even the AC joint.
Yeah, but so, but get in, yeah, adjust that SC joint,
Hmm.
adjust the CT, and then I can just say, "Go see the trainer for some therapy, boys."
Yeah. Let them do all the other stuff because obviously there's going to be multiple layers with something like a stinger for sure. Um,
Yeah, and so it's one of the things that is kind of interesting is the players are these guys are young. A lot of them are young. Some of them aren't, but some are veterans. But typically they come in there on when I see a lot of players are on Friday, they
mhm.
come up just working out. So
Yep.
these guys pretty, they're pretty loose.
Yeah.
They come in and
Mhm.
they want to get their final adjustment before Sunday, and so I don't see a lot of SI joint stuff. I see more. I do see some thoracolumbar, but more hip. So
Yep.
a lot of hip and posterior capsule, glute tightness, that external rotator tightness, and so I look at the hips real close on every player that comes in,
Mhm.
uh, especially if they complain of low back pain.
Have you also do you get the cornerbacks asking about that a lot? Because they gotta with their all their hip motion and stuff. I used to remember they like, "Oh, you check out my hips." They know everything about the hips.
Yeah, it's yeah, and people don't realize how much NFL football players run.
Oh, it's
These
crazy.
guys are squatting and lunging and running a lot, and so that yeah, the glutes, the external rotators get tight, and so yeah, but the offensive linemen get tight. They're tight too. So yeah, it's interesting. But yeah, I definitely see a lot of cornerbacks and safeties.
I was gonna wait for this question, but I think it's the time to do it. Do you notice differences in positions? Like, okay, I've got an offensive lineman. I'm gonna make sure I check their ankles because getting down into like the 3-point stance. I got the cornerback. I'm gonna make sure I check out the hips. Is
Yeah.
different things like that? Do you notice by positions?
I don't really. Actually, I don't. You would think, oh God, this, you're expecting Dr. Steve King to show up and say, okay, the safety is going to have this restriction, and the offensive lineman. No,
Yeah.
it's
It's all
just
similar.
it's very similar.
They all need ankle dorsiflexion. One might run a 4.3, the other one might be 400 pounds, but they still need ankle dorsiflexion.
They still, yeah, and a lot of their feet are terrible because they're beat
Oh,
up, and a lot of them, I always ask them if they played basketball because their feet are just terrible. So a lot of, so it's funny, but very similar.
yeah, for sure. Cool. And I actually wanted to go before I forget because I had one more question. And I respect the fact that probably like with a stinger, a lot of times that might be seen by the athletic trainer or neuro or
Yeah.
ortho first. So I'm sure in the clinical setting, they give you the diagnosis, but I know you know how to do it. And so for the audience that might be the gatekeeper and assess injuries, what are some of the signs and symptoms that you can really say, okay, yeah, this is a stinger?
Well, I think it's easy. For me, I always think of radiculopathy. So
Hmm.
I think of a stinger as just an acute radiculopathy. So you've got the radiating pain, and then some of the typical stuff, just the loss of range of motion in a particular direction.
Yeah.
And of course the palpatory pain, tenderness, and muscle spasm, usually in the scalenes, and then back to the whole upper trap and levator area.
Mhm.
And so, but I don't even actually, tying back to what you just asked, I don't actually even have a reflex hammer that when I'm in the training room. So yeah, it's like you said, they're seeing before, but yeah, you could have a loss of reflex on the particular side that's affected.
Definitely. And then probably
Um,
some of the mechanism of injury as well. And
Definitely the mechanism of injury. That is huge.
yeah, and I think that's a key with working with football players is that a lot of them are going to have traumatic injuries, and I think sometimes in our private practices we see a lot of overuse injuries and chronic pain and all that. You're going to have to sift, sort, and screen through a lot of traumatic injuries, and knowing that mechanism of how they hurt that is going to be very important.
Yeah, and as far as the Bengals are concerned,
Mhm.
a lot of diagnostic stuff is done, on Monday morning.
Yeah,
So if they're, yeah, so I'll have X-rays, MRIs. I'll be looking at MRIs before I even go and adjust the player. So
it's a mash unit on Monday.
it, but again, it comes back. It makes it kind of nice. It's like, hey, what's the story? Is there an MRI on this? Is there an X-ray?
How
Uh,
come you haven't talked with Dr. Mark King about having all that type of stuff in your office?
well, here's
Hey,
X-ray.
hey, when can I get a head neuro here in the office?
It would that yeah, I would like to have an MRI unit here, so that
Exactly.
would still be nice.
All right, let's go down to the low back. What are a lot of the stuff you're seeing with low back? Because I'm glad you mentioned that because I think a lot of our audience thinks football injuries. They're thinking hamstring strains, quad pull, like all these different extremity stuff, which obviously happens. But sometimes we forget like neck and back are still like number one and two. And
Yeah.
that's what you're going to see a lot, even with football injuries, not just knee injuries and stuff. So, what are you seeing with a lot of the low back stuff with these football guys?
Well, yeah, again, it comes back to what you were saying. Is it a traumatic situation, or is it or just kind of out of the blue? Like, so occasionally we'll see an acute disc
Hmm.
issue, and but more it's just, yeah, my back's stiff, and that's just the classic facet syndrome. And so yeah, so with this facet syndrome, for example, in the low back, the lumbosacral area, you wouldn't necessarily jump on the sacrum.
Yeah.
Uh, but again, I would work on the hips and the thoracolumbar oftentimes.
Well, I'll tell you what, that was one of the things with my training with MPI throughout school and early on. And when I got into working with football players, it was right away. And I noticed with them, a lot of the NFL, a lot of the football players in general are hyperlordotic in the lumbar spine. And so a lot of times I found that sacral counter nutation adjustment to like really, really help them out a lot. And so that was nice.
Yeah, occasionally do a little counter nutation
Hmm.
if it's low back. Uh, but again, yeah, a lot of times they'll point to the glute, or they'll just say I'm stiff. So it's
Hmm. Hmm. They don't give you a
really
whole
hard.
lot. That's for sure.
Yeah, yeah.
And then TL junction, I'm sure is getting hit up on all the time as well.
Yeah.
Definitely.
Yeah, I'm not sure if that helps answer your question as far as the low back goes. I mean, again, it's usually one hip is tighter than the other. And that's where, one of the things I'm going to demonstrate, possibly with this virtual seminars, is
Mhm.
what's called the Mulligan mobilization technique to help mobilize the hips. And a lot of times I'll focus in on one hip versus the other.
Yeah, and that's
And
what's going to be cool. Like you'll have this. There's going to be a component here of you doing some of the stuff you actually do
right.
in action there. So that'll be nice segue from
I
this.
do see some SI joint stuff. It's
Yeah.
just not. It's just surprising that it just seems like it's so much more in practice versus with these guys. And
Hmm.
I'm not sure if it's because they're so loose and warmed up and they
Hmm.
stretch so much and they kind of So it's interesting.
Definitely, definitely. And how about extremity stuff? Do you do a lot with them with extremity manipulation?
Yeah, it's mainly feet and hips and the shoulder, a little bit of shoulder
For
SC.
shoulder. Yeah.
Yeah, and then occasionally wrist, but definitely a lot of feet.
Yeah. That's a big
Somehow,
big problem child for them.
yeah,
Have you
and they
noticed that they
spread.
most of them have pronated feet?
Yes, it's unbelievable.
It is unbelievable.
It really is.
Yeah. I think it's like the vast majority of them have very flat feet for some reason.
Yeah, I'm not supposed to say names, but I remember I've been around for a long time, and I worked with Carson Palmer a lot,
Hmm.
and that poor guy, he had supinated feet, and
Uh,
he had chronic plantar fasciitis,
yeah.
and I think he had it for like 3 years, and so poor guy. Uh, anyway, that was an interesting. More, he had a little more supination than these
Yeah.
guys do.
That can happen for sure. But cool. That's exciting. I really think that covered a lot of the stuff. So that'll be great. So thanks for
Great.
this opportunity to interview you and do this for us.
Thank you so much, Kevin.
All right. Have a good one. I hope you enjoyed this week's episode. And if you want to make the shift from busy, broke, and broken to time free and cash confident, or you just want to continue with the exponential growth, check us out at modernchiropracticmarketing.com. Look at the MCM Mastery tab, watch the short video on there, and check out what we are doing now for evidence-informed chiropractors. We are equal parts coaching and marketing done for you. Yes, you shoot some videos, we help you with campaign strategies and ideas and really become a thought leader in your community. You shoot those videos, you send them to us, we produce, edit, and brand them to you. Then we distribute them through all of your channels. We also take them and we turn it into one good blog per month. And every other month, we have Darcy Sullivan producing a robust blog with a topic that you pick from her database to help with your SEO. So we essentially become your content marketing agency to make sure your practice is always having ethical, elegant content marketing to help grow your practice. On the coaching side, we also help you with everything from marketing ideas to business, communications, finances, anything practice growth, and really try to help prevent you from being stuck on that island. And we hold you accountable. We have a great group of doctors that are just doing amazing things, and we look forward to help you out to take that next step in your practice. So again, check us out at modernchiropracticmarketing.com and learn more.